One of the most terrifying moments.
Really don't want any other kid to have their, childhood ripped away from them.
It's isolating from your real life, but it has a life of its own. I'm Perry Zimmerman.
My name is Scarlett James.
My name is Jennifer James. My daughter is Scarlett.
My name is Dr. Kevin Curran. I am a pediatric bone marrow transplant physician and pediatric oncologist at Memorial Sloan Kettering in New York City.
My name is Diane Reedy Lagunes. I am the Associate Professor of Oncology at Memorial Sloan Kettering Cancer Center and the Vice Chair of Medicine for Operations.
I was born with genetic retinoblastoma, which is an eye cancer. Then when I was 2, I developed a brain tumor from the same genetic mutation. At 11, an ocular sarcoma in my leg. And then at 18, another ocular sarcoma in my shoulder.
Osteosarcoma is the bone cancer. It primarily affects teenagers. It's very difficult to treat. Part of the treatment sometimes is removal of the affected limb.
When I was 6 years old in 2013, I was diagnosed with stage 4 T-cell lymphoma.
The T cell is a very important cell. It's actually the one that we harness for our immunotherapy. If it goes to lymph nodes and grows into a mass, we call that T-cell lymphoma.
The next 2 years/3 years, I went through intense radiation, chemotherapy, as well as combination therapy.
When a patient is diagnosed with cancer, it's one of the most terrifying moments probably that our patient has yet to endure in their lives.
Obviously, it had a pretty big impact on my life as a whole and as a community and my family and those around me.
She was in the hospital for over a month, and we hung up all the cards on the wall. But it was her reminder that she wasn't alone and that everybody was thinking of her, and they all wrote her cards. And so that's a really special event. I just love the card project because you kids just write the most beautiful cards, and I know how much it means to the families when they receive, this big box of cards.
During my chemotherapy and cancer itself, we started a fund called the Scarlet Fund, and since then we've raised quite a bit of money, and we've been to so many different fundraisers like MSK Kids Walk and Cycle for Survival. I was just up at DC the other day lobbying for a bill to help with pediatric cancer and help with kids who relapse and helping them get more drugs that are needed to save their lives.
Going through life as a survivor, you just look at things differently. It's always there with you, even after you're done treatment. Even though, by the time of my most recent diagnosis, I knew what I was getting diagnosed with. I knew what was going to happen. I lost it.
I could describe pediatric cancer in one word. I would call it rare. I'd like to call it unfair. But, unfair doesn't seem like you're doing justice to all the hard work that the patient's going to go through.
Isolating because I was away from swimming, I was away from school, I was away from my friends. So it's isolating from your real life, but it has a life of its own.
Something that I think about all the time, and I think it's something that doesn't go away. It's part of my childhood. It was pretty much the entirety of my childhood, and it's something that I really don't want any other kid to have their childhood ripped away from them. And it's something I think about, and it's something I carry with me, and it's something that I hope to get rid of for other kids and try to prevent them from having to go through it.